What if you could sit down once a week with a colleague who's a flat-out warrior? This colleague wasn't a stud in dental school. He struggled. He returned to practice in his hometown, an area once labeled by USA Today as the second worst place to live economically in the United States. And this very same colleague went on to establish an historically successful general practice known worldwide. What if you knew someone that wanted to take you by the hand and show you everything you need to know, from treatment planning to leadership, to maximizing your journey in dentistry, or just life? You ready to be inspired? Welcome to the Lionhearted. Hi everyone, Dr. Steve Rasner is back, and welcome to the Lionhearted Dental Podcast. I like to check my download numbers right before I come on because it inspires me. But I am not inspired. I am not inspired. But you know what does inspire me? Great emails like I got today from a person. The subject of his email was inspiration. And I didn't know whether that was just some ad somebody was soliciting me with to, open up the email. But it happened to be a doctor that tuned in recently. And you know who you are if you're listening. So listen, the last two podcasts are really important. I need to go back and listen to them because honestly, they are the heart and soul of everything I do on the Lionhearted with you each week. And they stand alone probably as the number one reason I have been able to achieve whatever levels of success I've managed in our industry, in our profession. I mean it. And, being a warrior, not giving up, being organized, not feeling sorry for yourself, being tough-minded but fair, always caring about what you're building and your legacy. I mean, that would fly in the face of a lot of people that say, I don't care what people think about me. And, there's certain instances where that actually works, but it doesn't work when you're building a culture, within a small community. So I did two on these, and I have something really powerful to share with you this week. At least it feels powerful to me. And I was going to make the fifth step of the year. Remember, those of you tuning in, if you go back to January, I have 4 steps. I said back in January, let's wipe the slate clean and let's pretend we're starting over. What are the steps to develop what I call a Lionhearted dental practice, which so many of you get? And I love it when you tell me I inspire you and you share the philosophy. You should be inspired. Man, I wasn't anything in dental school. How many times I go back to this story? Here's one of my Achilles heel. It's ginger ale. It's probably horrible for my teeth, but refreshing. Yeah, I went to a dental school where I got my butt kicked. I went to Penn. And putting in 4 years of your life and time into something and coming out with really bad self-esteem, which I had a reason for it to be bad. Because I couldn't get one GPR. I literally remember feeling like I stayed back in school. Think about that for a minute. I went to college for 8 years, 4 undergrad, 4 to dental. And I couldn't even get a GPR? Not even a stinky one in the middle of a state where nobody wants to go? I don't know how hard I tried for that, by the way. So I ended up going back to my hometown with my dad. And I've said to you many times, I wasn't so sure how much he wanted me. But he didn't have many choices of other graduating dentists to join him. And I'm very thankful, by the way, for that opportunity. I mean it. So, yeah, you should be inspired. And then the ridiculous obstacles I've had to overcome in my career. And here I am with you. So I say that to you, not because I think I'm anything great. I'm saying it to you, with you, because, I mean, I still have a kick in practice 40 some years later. I like what I do. I certainly don't have to work anymore. And I haven't had to for a while, but it is because of all the things that we've talked about. And I know it's really hard to, you can sit in a lecture, you can sit in a podcast like this, listen to it on the way to work, and there's probably a lot of provocative questions that come in your head that I'm not able to cover everything. And then you get to work or wherever you're going, and just like you can't remember what a comedian says or what the movie was about in great depth, you probably forget and go on to the next thing in your life that day. And I get it, which is one of the reasons, one of the goals I remain to fulfill is a live 2-day seminar with you on all these principles, where it would be impossible for you not to get it. So let me get to what I think was an amazing epiphany by me in the last couple of weeks. And again, those of you that are tuning in, maybe you haven't tuned in a month or so. So I had back surgery in December. Devastating. I mean, like in a wheelchair for a while, back surgery. And you want to do something humbling, put yourself in a wheelchair and have somebody wheel you through an airport or something. It is, God bless all those people that are that disabled that that's where they're at in life right now. It is completely, as I said, humbling. And I told you last week that I don't know how exactly my path will be, but there's no way this is the end for me, physically. See, that's a warrior talking to you. And right now, I just came from PT to get here. And that young lady kicked my butt. And I don't like doing that kind of stuff, the stretching and all the yoga positions and all that kind of stuff, because just not what I'm used to doing, and I have to do it now or I'll never get better. But I will get better because I have too many things to do. And you need to get better wherever you're at professionally right now in your world, because you can certainly always improve the quality of what you're doing. It just always goes back to, how bad do you want it? Do you want a better life? That's what I'm talking about. How bad do you want to be fulfilled clinically and leave every day, to grow as a professional, to be financially rewarded as a person, as a doctor who has chosen to invest in his life? How bad do you want that? And you're going to hit bumps and roadblocks. Some like mine, some of them worse, some of them not as bad. And when you hit the roadblock, it could be financial duress. It could be health. It could be the loss of somebody. And I've had all three. Literally all three. And worse. And I am not saying that to you because I want you to think this podcast is about Steve Rasner overcoming stuff. No, I say it to you because I know that a lot of you have obstacles. You could be stuck in a not so great associateship. The income that you're earning after 8 years of college could be very disappointing to you. You could have invested in a practice, opened up, and you're not where you want to be. In fact, you're on shaky ground and you're not sure how to get out of it. I'm here to tell you that if you want it bad enough, any of those scenarios, as long as you don't give up and feel sorry for yourself. So my present dilemma in the last, I would say, 5 months is not as bad as any of the ones I just alluded to. And I'm going to entitle this podcast, the one 12 minutes into it, 10 minutes into it, I'm going to call it The Obvious Solution. The obvious solution. And that solution is giving more of yourself. And if you don't like that, then turn me off right now, because that's where I'm going. So for the last 6 months, I have experienced a negative impact on my practice. And you've heard me allude to it. Yeah, some of it, financially in particular, is about that I can't work 4 days a week right now. But I'm not really counting that. I'm really talking about disorganization in my organization. I mean it. I'm talking about open schedules. People, when I say people, I mean staff, failing to execute well-known protocols that they've been executing for years. I'm all about protocols. I wrote a book called The Protocol Book 20 years ago. I've talked about it enough. I'm not going to do it tonight. Lots of you have been asking for it lately, and I got to decide if I want to reprint it. That's the truth. So let's just talk about that. So staff members that used to do certain job roles stopped doing them. So here's one example. I want you to be in tune so that you can say, yeah, I get what he's saying. That happens to me. And so about a year or two ago, I got very upset when a patient who fell off the nucleus of our practice. You always hear me talk about the nucleus because it's so important. And I told you that sometimes a patient that you treated that's been off the radar for 3 to 5 years will show back up. What are you going to do? Not see them? Are you that busy? Are you that successful? I doubt you're listening to this podcast then. Because then you're probably fine. I don't know too many doctors like that. I don't know too many doctors that are like the old physicians and dentists when we grow up that says they don't take any new patients. Anyway, so this person spins off and they have a history of implants and maybe one of them's loose or something's wrong. And I don't like walking into a hornet's nest, not knowing anything about it. You know, one of the most crippling things we do, one of the biggest challenges, in my opinion, of being a GP, a general dentist, is that we have to incorporate hygiene. And one of the measures of our success, is it not, is how many hygienists do you have? And I have never found that problem more daunting than I have in the last couple of years, because I have 3 2 days a week. It's ridiculously difficult. By the way, ask me for the hygiene check slip. It's a Cliff Notes prepared by your hygienist. Then she will drop it in the room you're in, which means she has, or he has, some work to do before they drop it off. But here's my point. I might get a break. Pete Dawson taught me that, by the way, 30 years ago. He did. That's where I got it from. So I have, like everything I give you, you can edit it. So what it is each hygienist has either, not a picture. In my office, it's a symbol of who they are. So Valerie in my office has like a little fox because she loves animals. And I can't remember the other ones. She's also a fox. I'm going to get some mail on that one. So she's been with me 30 years, by the way. So, and what they do is they did they take x-rays today? What are there any new complaints from this? Is all the time. This is every patient. What time did they start? What time did they expect to finish? Any new complaints by the patient? Any medical changes? Any unfinished work or work that we spoke about in the past that we never proceeded with? I mean, wouldn't that be better for you to walk in than trying to figure it all out in a matter of seconds? How insane is it that you have a patient and you get a 5-minute check for an exam, which is hard to do, especially if you are doing surgery. It's impossible to do. But this really helps you get a little more sanity if you have 2 hygienists or even 3. And one of the rules, our practice is very strict about the 3 to 4 month recalls that are necessary with perio patients. And as a result of that, if they don't need anything, then on 3 or 4 month recalls, I'm happy not to go in. But the other paper that I'm talking about, now that's a change for a lot of you. And it means you have to write to me and request a hygiene check slip. But that was implemented many, many years ago, and I don't know how I would survive without it. So I can at least look at it for a minute and know what I'm walking into. However, when a patient falls off the radar, that's a different situation. So I requested that there be a thorough investigation report of that patient's treatment with me before that day. And that was the hygienist's responsibility to write that up. It's extra work. And you're not producing hygiene when you're doing that. But it makes the flow of the office. It makes me and your doctor make better decisions. I can send you a copy if somebody wants. That's different than a hygiene check slip on a normal recall patient. I'm speaking now about the patient that's been out of the practice, who's had heavy work by you. I mean, what if they complained about pain on the upper right? Before you walk in the room, do you not want to know what's up there? Is it an implant? Is it a bridge? Did you do the bridge? How many years ago? Have they broken recalls or have they been consistent? Well, we just said they fell out of the practice for 3 or 4 years. That's relevant. It sure is. So what I'm telling you in the obvious solution and the disorganization of my practice for the last 5 months is I noticed that stopped. And I had a major, not 1, 2 or 3 office meetings about implementing what I just told you. And everybody was on board. And they did it for quite a while. I'm not saying all my staff stopped doing it, but some of them did. Open schedules was another sign of disorganization. On myself, not on me, on hygiene. And I could say it doesn't matter to me because hygiene in my office get paid on production. Very well on production, by the way, because our fees are nice. And what if I ignore that? I could ignore it, I guess. I don't like that. I respect all the professionals, and I think you should, that work for you. And if they consistently, if you're okay with 1 or 2 or 3 broken appointments a day, that's how it's going to stay. And I'm not okay with it, but I let it go for several months. And just an overall reduction of production on my associates. Very easy for me to look the other way, right? Has no direct, great impact on me. And, I live an hour from Philadelphia. It's a big deal for me to get an associate to drive an hour. And they're not going to keep driving an hour if their schedules fall apart. You hear me? This is what's been going on. I have to say, in my opinion, poor morale and absolutely poor preparation. It's the antithesis of a Lionhearted practice. Poor preparation is the antithesis of a Lionhearted practice. So here's what was happening. I wonder if you can relate to this. I am telling you, since I came back from surgery, it's even worse. You would think it got better just out of people feeling compassion for their physically struggling boss, that they'd really want to make it smooth. But lazy patterns can be contagious. I don't care if my staff is listening to this right now. It's totally fine with me because I speak the truth. Lazy patterns that are allowed in your office become contagious. So I don't know. I don't know how it happened. I had an epiphany, and you know what was wrong? They didn't have a morning meeting that was anything close to what I used to teach. The lack of a morning meeting. So what was happening is, on occasion, if everything that was scheduled that day or any emergency that might have called happened to be perfectly fall into place perfectly by luck, nothing else, then I had a decent day. I was productive. I wasn't real behind. There wasn't any stress. Okay? I'm giving a course in 2 weeks. I gave one, in 4 weeks. I gave one a month ago. When you give a live surgery course, those patients have to come in for post-ops. I have to see them. My doctors who are in the course obviously can't see them. It's me. And I like a couple scattered each day. The breaking point came last week when I was off on Tuesday and I walked into Wednesday, and there was 13 patients on one schedule in addition to my normal schedule every 30 minutes. I can't think of enough. It was like April Fool's joke, but I didn't see it until 10:30 in the morning. Like I didn't notice because I have patients on the side a little bit during the day. You add that up, you add up hygiene. I'm busy. But most of my patients are multiple hour patients that are sedated. You see, everything I tell you has a purpose because it's much easier for you to practice if the patient's sedated. You can schedule 2-3 hour appointments and be very productive, and you don't have to rush. And it's very calming when you're in that room. But that doesn't give anybody the right to jam me in another room with 13 patients. So I went ballistic. What's that mean? I went to my front desk in the middle of the day and had an emergency meeting for 5 minutes, maybe 3 times that day. And I don't raise my voice. I don't have to. And those of you that are watching me and saying, oh my God, this guy's too much. He's a martinet. Like a military sergeant. No, I'm not. I need people to be accountable. You need people to be accountable. And so people spend a lot of money in a fee-for-service practice, which is a Lionhearted practice. They spend way more money to come to me than they could to go to Joe Doctor down the street who takes insurance, 75 plans, and whatever they get there. Okay? I believe we offer a much better product, as I know many of my colleagues that watch this do, and we're deserving of where we're at because it's not something that happens by accident. So, yeah, to be that kind of practice, you have to be on your game. And part of being on your game is a morning meeting. And I will say this to you. I had let it go. You know why I let it go? Because it gave me an extra 30 minutes in the morning to sleep. I'm sorry, Steve. That's not a good enough reason to go into a practice every day and wonder what's going to actually happen. And that's what was happening. So I changed it. I did. I sent out a memo and said, tomorrow, be prepared to start Don't come in. We need 15 minutes. Do not come in at the exact 15-minute. You need to be ready to speak, and do not make me ask you to be there. I'm sorry. I guess you can put this under another rant, because I'm ticked off that I have to do. You would think I did these meetings just like I'm telling you. Nobody fought me on them for 25 years, and I just kind of trusted my team in the last couple of years to do them. And so, like I said, sometimes you get away with it. You will never, ever have a worse day by having a morning meeting. If you have a morning meeting, the chances are significantly, like 90+%, that the flow of that day will be better. And we stopped, and guess what? Here's how. Did you ever go on YouTube? And when you're on YouTube, right, you think of other things other than the thing you went on to go YouTube for. And you start looking at that. Maybe it's a song. Maybe you look up Simply Red, that group. And when you're on Simply Red, another band pops up. And here's what, when you do a morning meeting, even if you structure like the way I structure mine, it leads you to other things that you would never have thought of. Now, they're all standing there at a long desk. I mean, my hygienists are there, the assistants, the front desk. Nobody is excluded from this meeting. I have to get up earlier. And I'm a little resentful because I spent years and years ingraining the importance of this, and you let it fall apart to the point that, and I guess I knew it all along. I was wondering, why is this happening? I swear to you, I sat with my most trusted managers, people, one of them with me 40 years, others with me 20. I said, why are we so disorganized? Like every day there would be another chaotic thing. And nobody would give me that answer. And it came to me, I don't know, like God sent. I mean it. Because it's something I've always done that I stopped doing. And I did it, and it's completely better. Other than the fact I get up a little earlier, who cares? It's worth the outcome. Because being disorganized and being the anti-Lionhearted practice is so toxic to so many parts of your being. It just defeats the whole purpose of everything we're doing. So ask me for my morning meeting agenda, because I don't want to go over every one of these. But basically, what we used to do is go over week-to-date production and collections. Because that was important, because if you don't notice... So I'll be honest with you. I had subliminal goals. They were not on charts in a room ever. But I used to want to produce and collect. And to me, it's the same thing. 80,000 for many, many years a week. And in recent years, it was higher. It was like 100. And if I kind of think it's not fair for you to be the only one that knows where you're at with the goals. I mean, if you're way off on a given week, all it means is be on your game. So what's that mean? Well, what if there's an opening in hygiene, right? And you're off on a week, like you're way behind where you should be. Maybe there's somebody in the office that you would have overlooked on a different week that could be slipped. Maybe they're in having operative work and can be slid over to hygiene. Or anything, maybe you need to prepare more so there's not an opening in hygiene on that week. I'm sorry, man. Hard work gives great results. You got 8 hours a day. You have 4 days or 5 days a week, whatever you're in, to make this work, to make it happen. I don't think that's asking a lot. I'm talking to you, doctor, and I'm talking to the team. What are you going to do and go half in? Then you're going to get half results. So we went over everything. I'm just going to pull out a couple. Do you ever have somebody show up and didn't take their pre-medications? Well, That just wasted a half an hour or 45 minutes. It blows the whole day often. Not the whole day, that 1 hour. So there are things we went over. Review the hygiene schedules. That they can't come in and start reviewing them at exactly when the meeting starts. I'm talking hygiene. They have to be prepared. Who doesn't need an exam today? What's the next phase of treatment? For you guys to take insurance, do we know what the remaining insurance benefits are for a patient with potential in hygiene? How about if you had somebody that when they called to confirm said they lost a giant filling on the upper right? Don't you think it'd be a good idea? Think about this. To know how much, I don't even take insurance, but wouldn't you think it's a good idea to know what their insurance covers? Or have they reached a maximum? Obviously, right now we're in the early parts of 2023. It's probably not a thing. Reviewing the doctor's schedule. Will it work as seen today? IT robots didn't put this schedule together. Humans did. Maybe it's overscheduled. Special needs, patients from out of town. When I'm doing this meeting, here's what happens. Things I can't tell you about right now pop in my head. And I said, don't forget to start doing this. You guys are slacked on doing this lately. I need that in part of your protocol. Do not miss that. Does anybody need an exit interview today? That would be a patient that's completing work or came in for a post-op check. More importantly, more relevant, maybe because we schedule 1 month after for those bigger cases. That's the perfect time to do an exit interview. Ask me what an exit interview is in an email if you'd like. So I'm going to leave you guys with this because we're at 32 minutes. I had an epiphany about something I've already did for 35 years. It was right in front of me. It was an obvious solution. And yeah, the sacrifice of 30 minutes in my day to have a better 8-hour day is well worth it. And those of you that run a sloppy, insignificant morning meeting and aren't at the goals that you want, maybe that's the reason. I said it earlier. You'll never have a worse day by having a morning meeting to prepare for that day. So don't skip the morning meeting. DrRasner at AOL.com if you want any of this. DR, my last name, at AOL.com. I really appreciate those of you that reach out to me. I'm thankful that I'm in this position to mentor some of you. Have a great week. It's already mid-April. We got to get the guns kicking. We got to get you in the mood of taking ideas into action so that you reach your potential. See you next week on The Lionhearted.